Hello. All right. Next question for today is from Tony. Let's have a look. Dear Dr. Ben, I appreciate the work you've been doing to keep people informed. So thanks. I'm trying. Um, we found out yesterday that the youth pastor that my college-age boys have been meeting with has been exposed to COVID. Pastor lives down the street from us and has been meeting with my boys a few times a week. My boys have been wearing masks. Good. Yeah, you raised them right. Good. Yeah. But the youth pastor hasn't. Yeah. Which is shocking, and I don't know. That really annoys me. When you know you're coming into contact with a lot of different people and close contact, and that's your job, why would you not take the basic step to try and keep those people safe? Why would it be more important that you not wear a mask than that you put the people that you're supposedly caring for at risk? Stuff like that makes me very, very annoyed. I'm going to push that down, and all right, let's continue. Yeah, this is frustrating since we've been so careful otherwise. We felt the boys needed the human contact. Yeah, I understand. Yeah. So anyway, other than quarantine ourselves, should we do anything else? Thanks for your help. All right, yeah. So the question is, when was the last contact? And then you're going to work from that date. So from that date, leave it about 7 days. And if you were to go for a test, they're going to ask you, like, have you had contact with a case? And you're going to say, yes, it's secondhand contact. But for a disease that jumps as fast as this one jumps, I think we can just cut out the middleman and just say it's contact. Yeah, so don't get tested too early, or else you'll get a false negative that won't actually tell you what's going on. Do watch for symptoms. There are a lot of symptoms other than the cough and fever. You got to watch for intestinal symptoms, diarrhea. You got to watch for various neurological symptoms, things like headaches, maybe nausea, just things that don't feel right. You got to watch for chills as well as fevers. This disease can kind of look like a lot of different things in different people. But regardless of the disease, I would say you want to go and get the actual virus test, the SARS coronavirus 2 test, or they'll probably call it the COVID-19 virus test, which, yeah, virus isn't called that, but that is the name that most people would know it by, so that's fine. And then, it'll be a wait for the results. You want to make sure that they are not in contact with anybody outside your household. And should they test positive, then at that point, the rest of the family would also need to go and get tested. But I think you can probably leave it until then, because we're actually 2 steps away from the case, or rather, your boys are 2 steps away from the case right now. Yeah. So quarantine, wear a mask, but more importantly, get that test done. There's insurance that'll pay for it. There's other ways, even if you don't have insurance, that will pay for it, and as those are supposed to pay the entire cost. I don't think there's a copay, but I don't know. Yeah, it probably depends place to place. But it's worth doing just for peace of mind. And yeah, I wish you the best. I wish them the best. And hopefully a week from now, it's come back negative. And at that point, you can get on with your lives, all of you. Yeah. But it's good they were wearing masks. That may, if they come back negative, that may be the thing that saved the day. So good job there. Good parenting. Yeah. I guess it never stops, huh? Mine aren't college age yet, but all right. Yeah, that's what I'm looking forward to. Thanks very much. This has been Ask Dr. Ben.